is a heated debate going on right now over the first and only drug approved to treat Alzheimer's disease in nearly 20 years.
More patients and politicians, including Maine Senator Susan Collins, are pressing to make Aduhelm more accessible. But there are mounting concerns about the drug's effectiveness, safety, and its $28,000 annual price tag.
Federal health officials are considering restricting coverage only to patients enrolled in clinical trials. News Center Maine's Vivian Lee tells us more.
3 years ago, Allison Fogel noticed her husband David was having difficulty trying to use his GPS and other normal tasks.
He was struggling with, things he used to do, it wasn't very difficult for him in the past.
David's memory skills continued to decline. The York resident was diagnosed with Alzheimer's disease in July of 2020. The incurable progressive brain disorder, which affects about 6 million people across the country, slowly destroys cognitive function and other skills. Last summer, David began receiving monthly transfusions of Aduhelm, the first and only drug to treat the disease. Thanks to the drug's manufacturer, he was able to get the drug for free, administered by Dr. Kent Logan, a neurologist based in Seacoast, New Hampshire. Dr. Logan says brain scans of some of his patients, including David, show a small decrease in clumps of toxic proteins known as beta amyloids in the brain, the root cause of the disease. And those patients are seeing less of a decline in memory and daily function skills.
I was amazed. 4 or 5 patients, they improved so well.
And you had never seen that in your practice of treating patients? How long have you been treating Alzheimer's patients?
For 20 years.
He feels independent, right? You feel?
Yeah, as long as you're around.
But Aduhelm remains at the center of controversy. Concerns about the drug's potential side effects, including brain swelling and bleeding, and the annual cost of treatment, which is $28,000. The Centers for Medicare and Medicaid is considering only covering treatment for people in clinical trials. And since January, the agency received more than 10,000 comments about the proposal on its website. David, meanwhile, has not lost any more skills, and the couple is willing to pay for the treatment out of pocket to maintain his quality of life.
He's still golfing. He's still going out socially.
Now, the agency is looking over those comments right now and is expected to make its final decision sometime in mid-April. In Hampton, New Hampshire, Vivian Lee, News Center, Maine.